Hello and welcome everyone. Thanks for taking some time today to see what we have and what we're all about. We are Pallativo and we are a hospice and palliative care EMR software. We recently rebranded and relaunched from an older platform, and we're excited to show everyone what we have in store. A little bit about me. I don't really like to talk too much about myself, but I've been involved in several different ventures in both the technology and healthcare space, including other healthcare software applications. I've got a background in private equity and financial services, and I'm a Florida guy through and through. I got my MBA from Rollins and bachelor's from Florida State University. So hopefully our team will pull around here later in the season. So a little bit about our company. We currently have different solutions that serve over 440 home-based care agencies. So spanning from home care to home health, hospice, and palliative care, and we've been in business for over 10 years. We do have what's a little bit different from some other companies is we have live support and dedicated techs, which means that if you ever have an issue or you need to talk to someone, you can actually call us and get a hold of us. We do process over 12 million visit check-ins a year, and that continues to grow. And really to bring all of this to one phrase, Pallativo is hospice and palliative care focused. Nothing more, nothing less. What that means is we're not trying to fit a hospice agency or squeeze them into a home health solution. For a hospice and palliative care agency, we have a solution that was designed specifically for hospices and palliative care agencies. So you don't get the extras and you don't get confusion about what goes where and am I doing home health documentation or hospice documentation. And the way that the software was built was actually side by side with our developers and with clinicians. So hospice nurses were building this, and we were saying, what is it that you would like to see in an EMR to help you do your job better? And this is where we kind of grew up from. So why the name Pallativo? So the name is a little bit new to us as we did a rebranding, but the name Pallativo is a derivative from palliative care. And we want to stay focused, and we're doubling down on our commitment to the hospice and palliative care industry. And really, we want to create the best possible solution in the marketplace that is specific to those agencies. Some of the things that we've found that agencies have been able to benefit from by using our software are things like saving an hour and a half of initial admissions. So cutting a 2.5-hour admission down to an hour. That's a huge amount of time savings. And you can think about how you could apply those admissions nurses or RNs otherwise if they're not spending that extra hour and a half on each admission. And then on typical visit documentation, we're typically saving nurses and clinicians about 50% of the documentation time. So we have a lot of shortcuts and things that make it easier to document, and we can show a little bit about that in this demo here. And then we also create claims out of the system, and that's through a batching process, which is done relatively quickly. So really you could have your whole month's billing done and sent off to the payers in about 15 minutes or less. So that's faster collections and then more time back to your admin staff that's running the billing. So again, our focus is on the palliative care and hospice documentation and reporting. So whether you're coming from paper, it's a really easy transition. It's not an extremely complex software. There's a lot baked into it, but we try and have it as easy of a interface as possible. And we can also have you live in just a couple of days. So you don't have to worry about the 3-month implementation time and, you know, having people sit with staff. We can do a couple of trainings and you're really up and running after that. And then also we have the potential for other integrations, whether that's an EVV system, payroll systems, clearinghouses, DME ordering systems. So really we kind of open up the door for all types of integrations if you already have something that you are using. So what we've noticed is it's really the little things that make us stand out. So things like role-based access or care. So each individual within that agency can have their own role, their own permissions, and their own type of documentation. And we also even allow certain documentation and logins for volunteers. So you can really get as granular as you want to be. We also have guardrails, so things that keep you from accidentally putting in a diagnosis that's not hospice related or, you know, an invalid primary diagnosis. And then we also automate things like the CAPS, HIS, and CAPI reports. Additionally, when a nurse is, you know, sitting down to document, and let's say it's a cancer diagnosis that has LCDs, we can bring those into the documentation automatically as a nice reference point for them as they're documenting. So the other thing too that's really helpful to keep away from errors and to keep people on task is we have a discipline-driven care plan. So each discipline, whether it's an RN or a home health aide or a therapist or a bereavement counselor, whatever that role is, you can set up that individual's care plan for that role. And then there's no confusion about who needs to document what. And you're not having people accidentally document things that are non-compliant for their role and so on. So again, we try to guard from those hiccups and those errors. We also have built-in reminders and alerts that can either go out or show up on your dashboard. So things like the CTI is about to expire, or you need a reminder for an IDG meeting, or to just sign off on it and make sure that that signature is recorded. And what we try to do is when you log in, you want to have all of the key statistics there on your dashboard. So you're able to quickly go in and see kind of the status of the organization. What's my current census? How many admits happened today? What are my discharges look like? So it really gives you a quick snapshot as to what's going on within the organization. So let's jump into a demo here. And this is from a nurse's perspective, more from the documentation side. So I'm going to bring this screen up here in just a second. And so here is the alerts dashboard that I was talking about before. We have expiring CTIs, alerts based on patients, and those can all be customized, and those can go to specific people in their care team. So it doesn't just blast out to everyone. You can have some that go out to the entire team, but if there are role-specific alerts that need to go to specific people, you can have those set up and they will automatically go out. So again, here's the quick stats dashboard that shows some charts that are helpful for you to understand the business. And then, so we're going to jump into the documentation side. So as we go into a patient, everything's driven from the patient side. So the entire documentation process is driven out of there. And then you see here on the patient face sheet that summarizes all the key information and demographics. You also have quick tabs that show you things like past orders, addresses, diagnoses, staff assignments, and so on. So it really makes an easy kind of one place, has all the summary information that maybe an administrator would need before they dive into individual documentation. And as you go into document visits, you have the options of doing the initial assessment, a regular visit note, an actively dying or quick assessment, and then also the option of doing a narrative note. So we allow some flexibility in the way that your agency drives documentation, and then also as the situation sees fit. So here's just the summary section of a visit documentation. And then we'll jump into a visit, and you can see these tabs here have all the details. And you see here how the interventions and outcomes show up on these tabs, and it's already pre-populated. Those were actually built for the RN and for this particular patient. So nothing that is irrelevant to this patient would populate in this area. That way the nurse doesn't even have to think about, do I have to document this or not? It's in the care plan and it shows up right in front of their face. So it really eliminates a lot of the time and the error that can potentially happen in documentation. Again, same thing with the outcomes. Those are all built out of the care plan for that specific role. So if I log in as a home health aide, I might have different interventions and outcomes here on this documentation. And we also have things like fall risk assessments, and it will then create a score out of that. You can see that here. So another really neat feature in here is the ease of which you can track medications and supplements. And we do have the full entire database of all medications. And then we can also document and have doctors e-sign certain orders. So if you have an order that came in from a doctor, you can have that e-sign come in and be documented here in the medication administration tab. And as I was talking about before, the plan of care, so you can see there's the different disciplines and having those set up, and then that'll build the plan of care. And then as I go into the plan of care, I can set up the interventions and outcomes that show up for that patient. And again, going back to the flexibility of Pallativo, you can always add in a one-time intervention or one-time whatever it is to maintain that flexibility, because we all know that things may happen during a visit that weren't planned, right? So you're able to do those one-offs and pull in different documentation elements on the fly. So it's really helpful to have that flexibility, but not be forced into all kinds of extra documentation that's not relevant. So here are the patient notifications that I was talking about before. You can set up different alerts that go out to different people in the care team. And then you have document storage. So you can store all kinds of different documents, whether it was scans, hospital records, whatever you need to pull in for that patient, you can pull in and store here. We also have a really neat feature that pre-populates the admission orders. So you can kind of have a standing template and then make edits from that, which saves time. And then one thing that I really love about this software is this patient progression report. So it's very hard in a lot of softwares to pull all that information together and see how the patient has done over time. And that's what this report attempts to do, is you can look at the progression of a patient and the status of them and their vitals as they go through the care process. And that's all charted out here. Really, really helpful from both kind of a case management standpoint, as well as admin when they go back, reviewing for like a discharge or something like that. to be able to really pinpoint and pull all that information in one place. We have built in the HIS reports as well as CAPS and the CAPI reports, but the HIS records are really easy to create. You would just hit add, and then it populates all the information, and then that's then exported to CMS. So I'm going to stop here and jump over to more of the billing and admin side. So as an administrator, some of the things that I can do as I jump into the software, obviously you have your dashboard still, but being able to run these batches of charges for your claims in just a couple of minutes makes a huge difference. If you're managing an ADC of 200 and you're still doing manual claims for each of those patients, then you're spending a lot of time on claims that you shouldn't have to. So you can always review the batches that you sent out. So each file that goes out, you can review those if you need to track them. And really, you know, one of the other things that we offer, let's see, my mouse is not working correctly here. There we go. Where I was here was, so we have a full library of help documents. So whether it's just the software itself, whether it's figuring out how to get your claims out the door, or maybe, for example, you just need some help on diagnosis to, you know, certain LCDs or other hospice related information. We do have that available and have some helpful documentation in there. And then as an administrator, I can also set up templates. So things like bereavement letters and admission orders, you can have all those templates ready to go so that all you have to do is hop in to the patient, make certain modifications, and send that out. So it really cuts a lot of time out of the whole process. And it also gives you documentation based on those bereavement letters, which is important in things like an audit scenario. One last thing that I'll hop into, one thing that I'll mention is you can hop back and forth between a hospice mode and a palliative care mode, which launches different elements of documentation and reporting. But one thing that I do want to show here is you can set those permissions that I was talking about before. There's a lot of administrative capability within this. And then you can give access to anyone that you want and set their login information. And then we also have all types of reports. So just as an example, if you wanted to track your average ADC over time or see all of your discharges and the diagnosis related to them. So I won't jump into all of those, but we have over 50 built-in reports, and you can slice and dice the data any way that you want to. And we have both visual reports as well as Excel exporting. So it's a really great tool, and I'd be happy to you know, show someone more in depth if there's any interest. And then I'll hop back over to my presentation here as we wrap up. So really getting to the why, you know, our software is specifically designed for hospice and palliative care agencies. So if there's one thing that you take away from this meeting, it's, you know, Pallativo is invested heavily in this industry, and we're reinvesting in the technology, and we're really excited about what we have to offer. It's really the clinician's choice software. So a lot of software out there may be built especially for the management team, and that's great, and it's really good to have nice visuals and statistics. But if your clinicians are not happy with the software that you're running and they're able to do their job better so that they can have more face time with patients, then that's going to drive more success in your agency. Again, we can get you onboarded and transitioned from either paper records or another software system relatively easily and quickly. And again, we can do web trainings and get you up and running in just a couple of days. And, the other thing too is, we serve all different sizes of agencies, and it scales up and down based on your ADC. So a small startup agency or a smaller agency that, they've looked at other software systems and have sticker shock, I think you find a really good value here with Pallativo. So if you need a cost-effective solution, we have something for you. So if anyone has any questions, you can certainly send any in on the Zoom chat, and I will try to get back to you after this meeting. But otherwise, I would reach out to sales@pallativo.com, or you can visit our website, pallativo.com, and just remember there's no I in it's not Palliativo. So pallativo.com. And if you want to reach out to an email, sales@pallativo.com. So that pretty much wraps up our demo time together. I know we have a few more minutes, but I can give that time back to you in your day. And I really thank you for your attention and your time today and investing in researching what solutions are out there. Take care.